Hi, Dr. Kristen here. I did a post last week about some supplements and some testing I had done and followed up with it a little bit earlier this week. And since I did that, I've gotten a number of questions from people wanting to know more about it. And so I figured I'd do a couple videos here to just kind of share some of my thoughts about vitamins and supplements and getting the right mix for you. So I remember being a little kid and having Flintstone vitamins in the cupboard and taking them not super regularly, but asking my mom for them. And when I was in undergrad, I remember like those Viactive calcium, like caramel chews were a thing that was around. And you know, when I'm going through the grocery store, I'll see those like supplement aisles with, you know, like the white bottles that have the rainbows on it, like Centrum Silver for seniors. And personally, I just think that there's no one size fits all vitamin, and that spending your money on that kind of stuff is really a waste because you're not assured that it's good quality, that it's actually filling the gaps that you need as a person, and that there's really any value to it. So that's not to say that I don't think supplements and vitamins can be super helpful and supportive. So there really is no such thing as one size fits all, just like there's no one typical person, right? Like we all have different bodies, we have different symptoms, we have different gut flora and bacteria and microbes that live inside us and help us digest our food, and different diets that we eat and different genetics, and all of those factors play a role in which supplements might or might not be helpful to us, might make things feel better, could make things feel worse, which ones will be most absorbable and useful to us. And so for those reasons and a few others, like I said, there's just no one size fits all. The other thing is that quality of the supplement you're taking really matters. Supplements aren't well regulated by the Food and Drug Administration, and so there are some safeguards in place. Like you might see things that have like GMP on them, and that means that they follow generalized manufacturing protocols that are determined as safe. But here's the thing, nobody really polices that. And the people that get, or the products that get in trouble are when they have been tested after the fact and are found to have been contaminated with something at the worst. Like there was a time a while back where there was a prenatal that was found to have high levels of lead in it, which lead is like really horrible for a nervous system. So just imagine high levels of lead in a prenatal where you're growing a baby from an embryo and it's all like brain and nervous system and crazy development. Like it's hard to imagine a much worse contamination. And that particular prenatal was one that was sold at Whole Foods. Like I've picked up supplements at Whole Foods when I'm shopping just so that I don't have to place a big order and I can get it there. So, I mean, if you're buying even what you think is a quality product, unfortunately, sometimes it comes adulterated. So that would be like the worst case. But at the best case, what if it's echinacea supplement because you have a cold coming on and it's all the inactive parts of the echinacea plant, right? Like echinacea looks like kind of like a daisy or a black-eyed Susan, right? And the chemicals that have those immune boosting powers are found in a certain part of the plant. What if it's all stems and leaves and none of like the echinacea-y like good parts of it? So like I said, quality matters. It's not a one size fits all thing. And so what do we do, right? Like just say forget it? Well, I don't think that's good either. Another factor that I missed but I want to cover is that dosage and absorption of them matter, right? So just like if you had strep throat, you wouldn't walk through a pharmacy after hours and like look at the antibiotics and think, okay, this is a bacterial, I need an antibiotic. Should I take sulfa or amoxicillin or strep throat, right? Like you'd probably pull out your phone and look at Google and see, well, for this kind of bacteria, it's most effective with this kind of antibiotic, but for some people they don't do well with this antibiotic, so then maybe they do that one, right? Like there's a whole clinical consideration that happens. And then there's some sorts of things like blood pressure drugs, right? Like you have all sorts of different classes of blood pressure drugs. Some people need one, some people need another, some people need a combination. Sometimes you have to tweak the dosage. Like there's a massaging into and a learning how your body reacts to something before you hit that right thing with medication. Now, it's kind of messy to compare pharmaceuticals and drugs and medications with supplements and vitamins because they're not exactly the same, for sure. But there's some similarities, and I think a lot of the studies that are done on the efficacy and the helpfulness of supplements and vitamins don't necessarily have the right dosage for the person for the length of time that they need it, or maybe their gut health is not good and they're not absorbing it well, or maybe they're not using a quality product, right? And all of that would affect the outcome. And so sometimes what it says on the bottle isn't necessarily the dosage or the amount that you need, or maybe you need help to get your gut health improved so that you can actually absorb some of the benefit. And all of that is really variable, right? So like I said, what do we even do? Just skip it, forget it, too complicated? No, because I feel like vitamins and supplements are a really great way to catch your health when you sense that there's some sort of imbalance forming, and to drag it back into alignment so that you don't end up with overt sickness or disease or imbalance that then maybe has you traveling down the pharmaceutical route, okay? So I think they're a really important tool for us to build our health and help us feel better. So what do I recommend? I say it's really important to work with a licensed professional. And it's not just so that I'm telling people like, come work with me because I want to help you, and I don't think you can get good information out there on your own or by working with lay people. And I'm going to explain why I think it's so important. As a licensed professional, I have had training, I've taken exams, I have done things that have given me a stamp that say, this person understands how the body works, they understand what could be helpful for it, they understand potential pitfalls and things that could be dangerous, and they've demonstrated that they have a good understanding of this information. You're likely to get safe care when this person gives you a recommendation. Along with that responsibility means that I get a license, and that license enables me to treat people and take money for treatments and to hopefully someday pay off my student loans that I have taken on to have those credentials, right? So if I tell somebody who's on Coumadin or warfarin, a blood thinner, because they've had a heart attack or a stroke, that they should take more grapefruit to alkalize their system, that's actually something that affects their ability to clot. That could have them bleed out, right? I know that. I'm not going to tell them to use grapefruit essential oil to get a lift in the morning. But the kid who works at CVS or Walgreens, or that super helpful person at the co-op, they maybe don't understand all of those things. So they may give you good recommendations that aren't going to be helpful at the best, or could be dangerous at the worst, right? And so that is one of the reasons why working with a licensed professional will help you get safe advice that I feel is, more trustworthy, obviously. The other thing is, as a licensed professional, I have access to working with very high quality supplements that can be very helpful because a lot of the manufacturers will only sell directly to people who know what they're talking about and have some skin in the game. And so that way then we know that in the case that, like I shared with before, of echinacea, like you're getting the most chemically active and helpful part of the plant. And so you're getting a high quality, more effective product. Also, all of the supplement companies that I work with are third-party verified and tested. So they make sure that what they say is in the bottle is in the bottle. They make sure that extra things like heavy metals and other contaminants are not in the bottle. And they do it before those bottles go out. So it's not like they test backwards to see who accidentally got lead in their prenatal, right? So that's another difference in the quality. The other thing that I want to say is Licensed professionals also use their knowledge of anatomy and conditions. A lot of times we have certain passions that we pursue in continuing ed, and so we continue to do learning and stay more knowledgeable than most other healthcare providers, because as chiropractors, I'll say me specifically and other chiros, we don't prescribe medications, right? So we have these guys, our hands here, to help get you feeling better, and we have lifestyle recommendations about diet and exercise and that sort of stuff, and then we have vitamins and supplements. So because they're a very integral part of our repertoire of materials, we tend to be very well educated, and many of us, like I said, seek more information and training on how to use those as tools to help you specifically. Sometimes we use things like detailed questionnaires and symptom surveys to help us identify which organs in your body might be under stress. Sometimes we run genetic testing in labs to see if you have genetic mutations that maybe make it harder for you to synthesize or absorb certain vitamins. I hear it beeping somewhere. They're replacing doors in the hallways, so hopefully if you hear it too, it's not too annoying, sorry. Some of us use labs, like we'll order stool samples if we're working on gut health. We will order blood work to see if you're showing signs of clinical infection. I have a lot of colleagues in the Twin Cities here who really have in-depth knowledge on those things. And there are some patients who I've referred to work with those docs because that is their jam and it is what lights them up, and they're super knowledgeable in it. I don't have as deep of a well as some of they do, but I'm for sure really passionate about pairing people with supplements that can help them get their body back in better balance. One of the tools that I personally use is a clinical technique of muscle testing. And so some of you will recognize this, right? Like you come in with acute back spasms and I grab magnesium and fish oil and some other things that I know will support decreasing inflammation and better tone of your muscles, and I will check strength in your muscles when I stress that stressed area to see, you know, which of these do you seem to resonate more strongly with, and I will make a recommendation of that. Sometimes we just need to back off from that acute symptom you're presenting with and do a full body assessment. So that is what I did last week in my own health that I was referring to. And that is a technique called nutritional response testing. So that's an area that I have done some advanced study in, and I can do another video on that later. If you ever want to explore kind of getting that whole body analysis. So those are some of my thoughts about vitamins and supplements. Again, like everything, it's not black and white. There's a lot of gray to it. But by all means, if you have questions about what supplements might be helpful, if you have supplements that you're taking that you're not sure if they're helping or potentially hurting, please talk to us about it, and we can kind of dig into that a little bit in the treatment room. All right, take care. Bye-bye.